Download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Roshni Dhal. Let's look at today's top headlines. The Medical Counselling Committee has released the seat matrices for the mop-up round of NEET PG and NEET MDS counselling. According to the seat matrix, a total of 9,175 MD, MS, PG diploma and DNB seats are up for grabs in the mop-up counselling, whereas for MDS specialities, 353 seats are available for candidates. The Gambia Nationwide Drug Regulatory Physique has not found any link between cough syrups from India and deaths of no less than 70 kids, and stated that some kids died without consuming the suspected medication, a neighborhood newspaper has reported. The regulator Medicines Control Agency has been investigating final months' mysterious child deaths that have been regarded as linked to cough syrups made by Sonipat-based Maiden Pharmaceuticals. However, the actual reason behind the acute kidney harm circumstances linked to the child deaths remains to be unknown, according to media reports. Monkeypox can spread before symptoms appear, British researchers said on Wednesday, providing the first evidence indicating the virus can be transmitted this way. Monkeypox, a relatively mild viral illness that is endemic in several countries in Western and Central Africa, exploded around the world earlier this year with outbreaks in dozens of countries where it had never previously appeared. It was previously thought that monkeypox was almost entirely spread by people who were already sick, although pre-symptomatic transmission had not been ruled out and some routine screening had picked up cases without symptoms. There have been almost 78,000 confirmed cases and 36 deaths since, according to the US Centers for Disease Control and Prevention. Although cases have peaked in many countries this week, WHO said the outbreak still represented a global health emergency. The District Consumer Court Redressal Forum, Orissa, has directed a hospital and its gynaecologist as well as its sonologist to pay a compensation of Rs 10 lakhs for allegedly providing a couple with poorly analyzed ultrasound reports, which resulted in the birth of a physically challenged male child. The case goes back to year 2021 when a patient first time pregnant was under the care of Dr. Himanshu Sarangi, gynaecologist at the CHC Patakura. The doctor advised the patient to get regular checkups and ultrasounds done for the safe monitoring of the pregnancy. After giving birth to the child, it came to knowledge that though the patient had got done her ultrasound thrice, which showed everything was normal and also accepted by the doctor, but her baby born suffered from disability and was physically handicapped, child having no right hand.
The American College of Cardiology and the American Heart Association have published a new guideline on the diagnosis and management of aortic disease, focusing on surgical intervention, considerations, consistent imaging practices, genetic and familial screenings, and the importance of a multidisciplinary aortic team. The burden of CKD or chronic kidney disease to both healthcare systems and patients is considerable. DAPA-Gliflozin, a sodium glucose cotransporter 2 inhibitor, was shown to be an efficacious treatment for CKD in the DAPA-Gliflozin and prevention of adverse outcomes in CKD, that is DAPA-CKD trial. A recent analysis in CJASN indicates that in patients eligible for the DAPA-CKD trial, DAPA-Gliflozin is not only effective from a clinical standpoint but also from a cost standpoint. A UK study published by the BMJ found evidence for substantial monkeypox transmission before symptoms appear or are detected, which is known as pre-symptomatic transmission. Transmission was detected up to a maximum of 4 days before the onset of symptoms, and the researchers estimate that more than half, that is 53% of transmission, occurred in this pre-symptomatic phase, meaning that many infections cannot be prevented by asking individuals to isolate after they notice their symptoms. Since the international outbreak of monkeypox in May 2022, more than 70,000 cases have been recorded globally, with just over 3,500 cases in the UK. Although case numbers are now declining, it's still important to understand the transmission dynamics of the virus. For example, how it spreads from one person to another and how quickly symptoms appear, to help inform policy decisions and future interventions. People with post-traumatic stress disorder or PTSD experience better sleep, a reduction in the severity of PTSD symptoms, and more effective treatments after exposure to blue light therapy, according to a new study conducted by researchers in the University of Arizona College of Medicine, Tucson's Department of Psychiatry, and recently published in Frontiers in Behavioral Neuroscience. The influence of sleep disruption on PTSD symptom severity is well established. Those who seek treatment to allay their PTSD symptoms often face a vicious cycle where poor sleep interferes with the effectiveness of treatments, negating any lessening of symptoms, which in turn contributes to sleep disruptions. To reduce and eliminate the emotional impact of traumatic memories, the patient needs quality sleep to integrate healing mechanisms achieved through cognitive or exposure therapy treatments. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.